Welcome to the pre-travel health and safety training module. Today, we'll be covering two main objectives. The first is to increase awareness of common infectious and non-infectious travel risks. We'll be covering topics like food and water safety, vector-borne illness, respiratory infections, occupational exposure, environmental exposures, and non-infectious health risks, as well as air travel-related VTE and jet lag. The second main objective is to learn steps you can take before and during travel to stay healthy and safe. Therefore, we'll cover things like the pre-travel medical consultation, the COVID-19 travel framework, and emergency preparedness in the setting of illness or injury. Here's an overview of travel-related risks. So the most common infectious diagnoses in travelers are GI syndromes, febrile syndromes, for example, malaria or dengue, dermatologic illnesses, and respiratory illness. The most common non-infectious causes of death include travel accidents, which we will cover later in this presentation. With regard to the pre-travel consultation, make sure this happens at least 2 months before you plan to travel. And keep in mind that depending on where you go for the travel consultation, there may be co-pays or charges, and various different options for the travel consultation can occur at the occupational health clinic, your PCP office, or the travel medicine clinic. Travel risk varies according to destination, season, duration of stay, the purpose of your travel and what you plan to do once there, accommodations, and of course you and your characteristics and any underlying medical illnesses you may have. Pre-travel visit topics to be addressed include immunizations, prescription medications, and of course counseling and advice. So let's dig deeper into food and water safety. Which of the following pathogens most commonly causes travelers diarrhea? A, parasites, B, viruses such as the rotavirus, or C, bacteria such as E. coli? The answer is C. Travelers diarrhea is the most commonly occurring illness in travelers. 40 to 60% of all travelers will experience this at some time or another. It tends to occur after 4 to 14 days of arrival. It is most commonly caused by bacteria, and ETEC is often the pathogen which is isolated. Traveler's diarrhea is characterized by malaise, anorexia, abdominal cramps, followed by the sudden onset of watery diarrhea, sometimes nausea and vomiting, and sometimes low-grade fever. High-risk areas include South and Southeast Asia, Africa, although not South Africa, Mexico, Central and South America. Traveler's diarrhea is nearly always benign and self-limited. Symptoms tend to last about 1 to 5 days. However, if they last longer or are associated with persistent fever, bloody diarrhea, or you're unable to tolerate even fluids, please seek medical advice. Here is a table with the various different pathogens, including bacteria, viruses, and parasites that might cause traveler's diarrhea. In terms of prevention, drink and water selection is key. Drink only bottled, boiled, treated, filtered water and beverages. Make sure that there's a seal on the bottle and that it has not been broken. Ice in drinks is not safe unless you know that it's from adequately boiled or filtered water. Keep in mind that freezing and alcohol do not sterilize water. Also keep in mind that when you brush your teeth, when you rinse foods, or are washing kitchenware, if all of these are done with untreated water, you can also be at risk for developing traveler's diarrhea. In terms of water purification strategies, there are several. So one is to boil water for 3 minutes. Another is to add 2 drops of 5% bleach to a quart of water and leave it there for 30 minutes. Another option is to add 5 drops of iodine to a quart of water and leave for 30 minutes. And the last is to use a compact travel water filter, for example, the Life Straw or Sawyer, which are pictured here. Food selection is also key. Eat only well-cooked meats, fruits, or vegetables, and avoid smoked pickled meats or fish. If you do eat fresh fruits, it should be fruit with a protective peel or rind that you have removed yourself with clean hands, for example, bananas. Keep in mind that condiments can be contaminated, especially those that have been sitting around on a table uncovered. Street food is high risk. And certain fish, for example, barracuda, red snapper, grouper, sea bass, and other large carnivorous tropical reef fish could contain certain toxins that are not killed through cooking. With regard to management of travel's diarrhea, there are several steps you can take. So most importantly is rehydration with clean water. So for example, please carry oral rehydration salts, which are pictured here at all times, especially if you're in remote areas so that you can consume them if need be. Please use anti-motility agents cautiously and definitely do not use in the setting of bloody diarrhea. In terms of antibiotics, we recommend azithromycin 1 gram PO times 1 or 500 milligrams PO daily times 3 days. This is especially recommended for all travelers to Southeast Asia and can also be used elsewhere. An alternative to azithromycin is fluoroquinolones. So for example, you can take levofloxacin 500 milligrams as a single dose, and if you still have symptoms, can continue this for 1 to 2 days until your diarrhea has improved. Keep in mind that there is Campylobacter resistance to fluoroquinolones in Asia, so do not use this when you're in Asia. Here are examples of different rehydration salts that you can travel with, and please do so. Keep them on hand, especially if traveling in remote areas. We will also be covering typhoid fever as one major cause of travelers' diarrhea. Typhoid fever is found in Central and South America, Africa, and Asia. It's transmitted via oral fecal route and caused by Salmonella typhi. Clinical manifestations include clinical manifestations include fever, abdominal pain, and diarrhea. In terms of prevention, hand washing, avoiding untreated water, raw fruits, vegetables, or undercooked foods is key. And there is a vaccine, which we will talk about later in this presentation. So the next big topic that we will be covering is vector avoidance. The prevention of insect bites is key here. So in terms of mosquito avoidance, please sleep with bed nets where appropriate. Nets should be tucked and have no holes in them. Please use an EPA-approved insect repellent with at least 20% DEET. Keep in mind that using anything above 30% DEET will not increase efficacy and will only cause irritation on your skin. Permethrin 0.5% may also be used and sprayed on clothing or bed nets, although soaking is the preferred method. Permethrin is quite potent, even 2 to 6 weeks, and even if you've done your laundry. Please wear loose clothing with high necklines, long sleeves, and long pants, and avoid wearing bright colors, shiny jewelry, anything that might attract mosquitoes. If possible, stay in a room with air conditioning, and definitely stay in a room that has screens on its windows. Of course, malaria prophylaxis is also another way to prevent malaria. In terms of malaria, as we all know, this is caused by the bite of a mosquito. It's a parasitic illness present in most tropical regions of the world. In terms of its clinical presentation, it can cause fevers, chills, diaphoresis, and headaches. There are serious complications which can occur, which include cerebral anemia and liver failure. Prevention methods include vector avoidance and anti-malaria prophylaxis. Here's a map from the WHO showing areas where malaria is endemic. With regard to malaria prophylaxis, keep in mind that it is not 100% effective. Therefore, you should seek medical advice if you develop a febrile illness during or up to 3 months after a trip. We recommend Malarone as first line for chemoprophylaxis. And in terms of treatment, one thing to keep in mind is if you are unable to be evaluated wherever you are, there's a low threshold for empiric self-treatment. There are a couple different options for this. One is the Malarone itself, so keep a few extra pills on hand, or Coartem. Coartem is usually readily available and is not expensive. The Zika virus is a virus that we heard a lot about a few years ago, as we all know. There's less of it, there are fewer outbreaks now, but it's important to know a little bit about it, especially if you're going to a country where there have been outbreaks in the past. So in terms of epidemiology, it's also transmitted by a mosquito, the same mosquito that transmits the dengue virus and yellow fever. It's present in most countries in the Americas and many countries of Africa, South and Southeast Asia. In terms of clinical presentation, what's interesting about this is that 80% of those infected are asymptomatic. However, if you do develop symptoms, they can include fever, arthralgias, a maculopapular rash, or conjunctivitis. This is a map of the global Zika virus burden. It's from the CDC from the 28th of January of this year. As you can see, the only continent with a current Zika outbreak is India. Here we will review Zika and pregnancy. So in terms of sexual transmission, from women to men for up to 2 months after exposure, and from men to women for up to 3 months after exposure. Zika has been associated with congenital malformations, including microcephaly. So the CDC guidelines recommend that all pregnant women should avoid travel to areas with active Zika virus transmission and avoid pregnancy for 2 months after leaving an endemic region. What's important to know is that infection with Zika virus is unlikely to affect any future pregnancies. Here we'll go over dengue, also known as the breakbone fever. In terms of epidemiology, this is a viral disease transmitted also by a mosquito present in the Caribbean, Central and South America, the Western Pacific Islands, Australia, Southeast Asia, and Africa. Symptoms begin within 4 to 7 days after a bite. Those symptoms are usually mild, including eye pain, myalgias, bone pain, joint pain, fever, headache, nausea, vomiting, and rash. There are serious complications, however, and these can include shock, hemorrhage, and even death. Here's a map of dengue risk. And you can see the parts of the world that I just touched upon in the previous slide. In terms of yellow fever virus, this is also spread by the mosquito, found in parts of South America and Africa. With regard to its clinical presentation, some of those who contract yellow fever develop very serious illness, which includes liver dysfunction, hemorrhage, myocardial injury, CNS dysfunction, and death. Preventing yellow fever is possible. There is a vaccine, and of course, vector avoidance is key. Next, we will cover various pre-travel immunizations. So of course, it's important to make sure that all of your routine immunizations are up to date. Those include influenza, Tdap, which should be every 10 years, MMR, and keep in mind that for polio, adults who've completed a polio vaccine series as children should receive a one-time booster dose of IPV if traveling to areas with increased risk of polio. Varicella, hepatitis B, and of course, COVID-19. With regard to country-specific vaccines, they might include yellow fever, which we'll go into in a little bit, typhoid fever, hepatitis A, Japanese encephalitis, and the meningococcal vaccine. A little bit about the typhoid fever vaccine. So traditionally there have been 2 options. One is the intramuscular injectable version, and the other is the live attenuated oral vaccine. The inactivated injectable vaccine, its immunity lasts for about 2 years, and that one is available currently. The live attenuated oral vaccine has been temporarily discontinued as of this talk. Its immunity lasts for about 5 years. It's not recommended for the immunosuppressed, given that it's a live attenuated vaccine. And its effectiveness can be reduced by concurrent atezolizumab. Let's discuss the yellow fever vaccine. So this is a 1 lifetime dose. There's no booster required. It may be required for entry to some countries in Central America, South America, Africa, and Asia. Some countries may require proof of vaccination prior to entry if arriving from a country known to have yellow fever. This can even include layovers sometimes. And it must occur at least 10 days prior to arrival. Proof of vaccination must be provided on an official international certificate of vaccination or prophylaxis card and must contain the signature and official stamp of the licensed vaccine provider. So I've put here the yellow card that I'm referring to. This is a live attenuated vaccine and therefore contraindicated in immunodeficiency. Keep in mind that there are rare cases of neurotropic and viscerotropic disease as a result of this vaccine. A waiver can be written for patients with contraindications to the vaccine. The doctor must fill out the medical contraindications section of the yellow card and write a waiver letter. Please see to the right here, the medical contraindication to vaccine section. Keep in mind that whether or not it will be honored cannot be guaranteed, so you should confirm with the immigration authorities prior to travel. Here are various regions around the world where there is yellow fever, so it includes parts of Africa and parts of South America. The meningitis vaccine is a vaccine to be considered if you are traveling to the meningitis belt in Africa. The highest risk is in December through June, but we recommend also receiving this vaccine outside of that higher risk season. Our next topic will be occupational exposures. There are various types of exposures: occupational, environmental, or sexually transmitted. In terms of occupational exposures, the highest risk comes from a hollow bore hypodermic needle exposure. There's also the risk with regard to mucocutaneous exposures. The average risk of infection by percutaneous route of exposure for hepatitis B is 30%, hepatitis C is 3%, and for HIV is 0.3%. The best prevention is, of course, avoidance of the exposure. So please always use universal precautions. Do not do procedures without supervision. Do not do procedures if you are uncomfortable, and please don't be afraid to ask for help. Immediately after an exposure to blood or bodily fluids, do the following. If it's a skin exposure, wash with soap and water. If it's a small wound or puncture, cleanse with an antiseptic such as an alcohol-based hand hygiene agent. If it's a mucosal surface exposure, flush the exposed mucous membranes with copious amounts of water. If it's an eye exposure, irrigate with saline or water. With regard to HIV Post-Exposure Prophylaxis, or PEP, please initiate it as soon as possible and no later than 72 hours post-exposure to blood, blood-containing products, genital fluids, breast milk, or amniotic fluid. If feasible, you should undergo baseline testing for yourself and your patient, again, if feasible. The recommended regimen includes raltegravir twice a day or dolutegravir daily and Truvada daily for 28 days. So if you do have a possible HIV exposure, start PEP as soon as possible and no later than 72 hours after that exposure. Upon your return, please call UCLA's Occupational Health Clinic. Here's the number for an appointment and follow-up testing. This is just to emphasize that PEP needs to be started as soon as possible because the benefits decrease after 72 hours. Our next topic will be environmental exposures and non-infectious travel health risks. First, we'll cover sun and heat. So please always wear a hat and sunscreen if possible. Please try to avoid dehydration. It's quite important to remain hydrated even when it's humid in tropical regions. Humid weather can mask dehydration, so remind yourself to drink lots and lots of fluids. Please keep potable water on hand. Next, we'll move to the mountains and the sea. In terms of altitude exposure, acute mountain sickness, or AMS, can occur at around 6,500 feet, and symptoms include headaches, lightheadedness, loss of appetite, nausea, vomiting, fatigue, sleep disturbances, and mild shortness of breath. These symptoms can be mitigated by a slow ascent and by using prophylaxis with acetazolamide. Other things that can occur with altitude exposure include high altitude pulmonary edema and high altitude cerebral edema. These tend to occur at close to 10,000 feet. With regard to Scuba diving and swimming. Please avoid flying for 24 to 48 hours post-dive to avoid decompression sickness. Always, always swim or dive with a buddy, and avoid swimming in fresh water where there may be schistosomiasis. Next, we'll cover animal and insect precautions. Please keep in mind that animal bites and scratches can occur and can cause major issues. So please try to avoid all animals, even pets. If you're bitten, scratched, or stung, please wash the wound immediately and seek medical care. Keep in mind also that if you're bitten by a stray dog or other animal, you may require the rabies vaccine and immunoglobulins, which may not be readily available wherever you are. And in that case, you would have to be evacuated. Please see prior slides on insect and vector precautions, which we've already covered. Here are some general safety precautions when it comes to avoiding injury and violence. Please always wear a helmet, wear seatbelts, drink responsibly, stay alert in crowds, follow local laws and customs, and please understand local crime risks. This plot here shows that road traffic accidents are the leading causes of injury, death for US citizens in foreign countries. So we'll delve a little bit more into road safety. We generally discourage renting a car, riding motorbikes or minivan, public transportation. Please always wear seatbelts and helmets. Avoid drinking at night, and do not drive under the influence of alcohol, drugs, or sleep deprivation if you must drive. Please become familiar with local driving laws and conditions, and be aware that in many countries outside of North America, manual transmission vehicles are the norm. A little bit more about injury and violence. To mitigate the risk for violence, including sexual violence, please assess the risk at your destination prior to departure. Always remain vigilant. Avoid going out by yourself. Limit going out after dark. Limit alcohol intake, and consider local customs of etiquette and dress. If you're a victim of violence, including sexual assault, get to a safe place as soon as possible. Access medical care if necessary. Please contact the nearest US embassy, or you can call the Department of State within the United States for assistance. And this assistance might include medical or other type of assistance. Call your local emergency contacts, and you can call the UCLA operator. In terms of emotional or psychological support for victims of sexual assault, there are several resources that are national or local at our UCLA campus, including the Rape Treatment Center, which is available 24/7. LGBTQ plus travelers can face challenges traveling abroad. Travelers should familiarize themselves with local laws, cultural attitudes, and tolerance. Laws and attitudes in some countries may impact safety and ease of travel, and legal protections vary from country to country. As you can see on this plot over here, this map over here, there are various different legal protections depending on which part of the world you're in. In terms of resources, this Department of State has a good resource, which is listed here at the bottom of this slide, for those of you who'd like a little bit more information on this topic. I'd like to touch upon air travel and the risk of venous thrombus embolism. So prolonged travel does increase the risk of DVT and PE, as we can see on this plot. The risk remains for about 2 to 8 weeks after travel, and of course is increased in patients with underlying risk factors. Venous thrombus embolism risk increases with the length of flight. Things to keep in mind are that a DVT can cause leg swelling, pain, redness, and warmth, and a PE can cause shortness of breath, tachycardia, tachypnea, chest pain, or cough. If any of these things happen to you, please seek medical help immediately. In terms of prevention, there are several things you can do to mitigate the risk. One is frequent mobilization. The other is proper hydration, avoiding sedating medications or alcohol, the use of compression stockings, flexing and extending the ankles and knees during the flight. And if you suspect you may have developed a DVT or PE, seek urgent medical evaluation. Another issue that arises when traveling across continents is jet lag. This is, of course, experienced by most travelers and includes symptoms like sleep disturbances, daytime fatigue, GI issues, and reduced productivity. In terms of treatment, You can adjust your schedule to the local time immediately upon arrival. Melatonin has been shown to be beneficial in some studies. A Cochrane systematic review showed it reduced jet lag in 8 out of 10 studies, in fact. We will also cover our COVID-19 travel framework, so please go to our Global Health Program website and review the COVID-19 travel framework. In summary, review the CDC COVID-19 country-specific travel recommendations. This will include the CDC risk level, any sort of specific quarantine or isolation guidelines, and how that might impact your travel time, which is important for trainees. So be sure to mention any of this to your program director. Pre-travel COVID-19 testing requirements. So most of these places do require a COVID-19 PCR test before travel. Confirm travel and emergency evacuation insurance through UC Travel. Confirm that borders are open. Describe any plan for quarantine or isolation. For example, where you might do so, who your emergency contacts are, funding to stay longer or to switch your airfare or flight, and nearby health facilities if you should need one. Please practice safety measures to lower your risk of COVID-19. Please review PPE sources in country and plan for PPE while performing clinical duties. Also consider these resources and equity among your local colleagues. All trainees must be fully vaccinated and are advised to carry physical and electronic copies of the vaccine card. And please arrange for COVID testing prior to return to the United States. Per current guidelines, it is COVID-19 tests are required to return to the US. In terms of emergency preparedness, please carry with you at all times your contact information for the nearest US embassy or consulate, local and UCLA emergency contacts, a copy of your passport, travel insurance card, itinerary, vaccination card, and proof. Please research how to access healthcare services at your destination. We would recommend packing a health kit with supplies for common ailments, as well as your own medications. And please know when to ask for help. So for example, if you're sick with a high fever, unable to tolerate POs, if you are bitten, if you're in a car accident, you're assaulted, or you're experiencing any sort of mental health crisis. And please register in the Smart Traveler Enrollment Program, or STEP. This allows the State Department to find you in case of an emergency. And finally, here's some UCLA resources. The UC travel insurance and evacuation insurance, travel and safety tips from our website, and information about post-exposure prophylaxis. Some other resources include the CDC, as well as the United States Department of State. Safe travels. Thank you for listening to this.